Madam President, I rise to speak on health care, but I'd like to ask unanimous consent that I be able to conclude my remarks prior to going into executive session.
Is there objection? Without objection.
Thank you very much. Madam President, I rise today to speak against the Republican effort, what it appears to be thus far, to repeal the Affordable Care Act and the process they're using to do it. I've just got to say, this is the least transparent process for a major piece of legislation I have seen in my 24 years in the Senate. Former Senate historian Don Ritchie said that you have to look back before World War I to find another example of such a secret partisan process for passing a major bill. The Senate health care bill, in fact, is being written behind closed doors. There's no draft for public review. No Democratic senator has seen the bill. Republican senators all say they haven't seen the bill either. When Republican senators are asked what's in the bill, unless they're the 13 privileged ones, they say they have no idea. Everyone except the 13 Republicans drafting this bill has been excluded. And these 13 senators represent just 10 states out of our 50. Health experts and health advocacy organizations have been shut out. No one representing doctors, nurses, patients, children, the elderly, hospitals, community clinics, or health plans is able to provide any feedback at all on how the bill would affect people. Over the weekend, the Los Angeles Times reported that a coalition of more than 15 patient groups, including the American Heart Association, the March of Dimes, and the American Lung Association, tried to get a meeting with Senator McConnell or his staff and were told no. That's unbelievable. Think of it. Think of the American Heart Association, the March of Dimes, the American Lung Association, asking to meet with either the leader or his staff, and somebody says no? Do my Republican colleagues really believe that groups like the American Heart Association don't deserve an opportunity to weigh in on a health care bill when our health care system affects every single person in this country? Health care is the last subject that should be addressed behind closed doors, hidden from public view. Yet, apparently, Republicans intend to bring the bill to the floor without a single hearing. Senator McConnell wants to vote on a bill by next Thursday, I'm told. That's 10 days from now. Well, if there's not going to be a hearing, we shouldn't vote. I think no hearing, no vote. It's important to point out the contrast between what's happening now and our consideration of the Affordable Health Care Act. That's what's known as Obamacare. There were 100 hearings, meetings, roundtables, and walkthroughs of the bill between the Senate Finance and the Health Committees. There were 25 consecutive days and 160 hours of debate on the Senate floor. There were 300 Health Committee amendments, including more than 160 Republican amendments. Was our process in 2009 and 10 perfect? No, it wasn't. But it's infinitely better than what's happening now. This process is such an affront to our democratic system of government. Take for this, Senator Harris and I represent California. We are the 6th largest economy in the world. We represent more than 40 million people. That's more than 22 other states combined. 14 million Californians are covered by the Medicaid program. That's the program that the House bill says we're going to stop the funding for. 14 million Californians are more people than the entire population of 9 of the 10 states represented in the secret health care negotiations. 4 million Californians gained health coverage under the Affordable Care Act, more people than the population of 4 of the 10 states represented in the secret negotiations. Despite the significant effects of any health care bill would have on California, both of its senators have been shut out. I want to work to improve affordable care. I know there are challenges that we need to address, and I want to be part of the process, but there's no opportunity to do so. If the Senate bill is anything like the House bill, the effects would be devastating on my state. If the Senate bill is like the House bill, here's what it would do. It would take health care coverage away from 23 million working and middle-class families to finance a tax cut for the richest 5% of Americans. This is indefensible. There's no justification for giving millionaires a $50,000 tax break by taking health care away from our most vulnerable citizens. And I don't know of any that are asking for it. It's some kind of blighted political agenda that you can leave the elderly and the sick untended, and it justifies a $50,000 tax break for a millionaire. This would end Medicaid as we've known it for 50 years by cutting $834 billion. It eliminates protections for people with pre-existing conditions. It defunds Planned Parenthood. It denies all Californians and New Yorkers, all of them, tax credits unless the states change their laws requiring insurance companies to cover reproductive care, including abortion services. It's almost kind of a blackmail provision. I'm going to talk more about the potential changes to Medicaid, known as Medi-Cal, because it's startling. Everyone needs to understand that the changes Republicans have proposed and we think are proposing for the Senate bill go much further than repealing the expansion of the program, which was a big part of the Affordable Care Act. It's been reported in the media that Senate Republicans are looking at changes to Medicaid that are similar to what's in the House bill. There are rumors that the Senate bill would delay the drastic cuts by a few years, but regardless, when cuts to the program come, they will be devastating. Now, who does Medicaid provide health care to? It's not the wealthy. It's elderly people in nursing homes. It's pregnant women. It's children. It's people with disabilities. And it's low-income adults who typically work but don't get health insurance through their jobs. Medicaid covers 1 in 3 Californians. That's 14 million people. It covers 1 in 2 children. It covers 3 out of 5 nursing home residents, where they say 3 beds would be lost in each home. It covers 1 in 2 people with disabilities. And here's something the American people need to understand about Medicaid. The majority of Medicaid dollars are spent on elderly people and people with disabilities. They are the most in need, and they have the most serious health issues. Let me give you one story. A woman by the name of Kristen from Sacramento wrote to us about her daughter Riley, who is autistic. Riley is covered by Medi-Cal. It provides critical services that allow her to lead a more normal childhood. And here's what the mother said. When my daughter Riley was born, we quickly learned that she had difficulty with basic tasks like sleeping and eating. She developed pneumonia multiple times. She was continually sick. After turning 3, she was diagnosed with autism. She's now 8 years old, and she is thriving thanks to Medicaid-funded support programs like physical therapy, speech therapy, and feeding therapy. She is now verbal, learning to write, and she is reading above grade level. She wouldn't be doing this well if it weren't for Medicaid. I am counting on you to protect Medicaid, end quote. Every community in California depends on Medicaid. Let me give you a few examples. Members here of both political parties go to Los Angeles to raise money. 40% of LA County is covered by Medicaid. Do you know how many that is? It's not 500,000. It's not 1 million. It's not 1.5 million. It's not 2 or 3 million. It's 4 million people that could lose the Medicaid funding. 28% of San Diego is covered by Medi-Cal. That's more than 900,000 people. And 37% of Sacramento County is covered by Medi-Cal. That's 56,000 people. And half of Fresno County is covered by Medi-Cal. That's 500,000 people. I was in Fresno just a week ago, and there's a wonderful children's hospital. And the director of that hospital came over to me and was practically in tears. He said, "We treat 300,000 children up and down this area of the state, and we lose our Medicaid. We cannot continue to provide that treatment if that takes place." Fresno has 31 assisted living facilities for the sick, for the elderly, and they would lose 3 out of 5 beds in that facility. And 27% of San Francisco County, my home county, is covered by Medi-Cal. That's 230,000 people. What Republicans, we learn, may likely propose would end the Medicaid program as we've known it for more than 50 years. Under current law, the federal government pays a certain percentage of all health care costs for Medi-Cal beneficiaries. We will likely see a phase out of the current structure of the program. That would amount to $834 billion cut over 10 years, with 14 million people losing coverage nationwide. They'll be in your state, Madam President. They'll be in every state on the Republican side of the aisle. And I don't know how a civilized society or a Senate of the United States could do that to people. The effects of this change could devastate access to health care for our most vulnerable citizens and crush state budgets nationwide if they try to replace those funds. Bottom line, in my state, by 2027, California would need to find $24 billion to cover those who depend on Medicaid for their health care today. Now, what's going to happen with pre-existing conditions? We all know that the Obamacare legislation covers pre-existing conditions. So if you have breast cancer, you can get coverage. And you could be charged $28,000 more per year if the pre-existing condition of breast cancer isn't covered. And it goes on and on like this. If you take away coverage for pre-existing conditions, and you have, as we have, 52 million people nationwide, including 6 million in California, that have pre-existing conditions today, that will be a big, huge problem for them. Let me give you one case It's a woman from Hesperia, California. And she wrote to us about her 37-year-old son. And he has battled Crohn's disease for 20 years. And Lisa writes, "My son was without insurance for 10 years because of his pre-existing condition." That's before Obamacare. During this time, the disease caused severe damage to his small intestine. He was finally able to get insurance through Covered California and receive treatment. That's after Obamacare passed. He had surgery to remove various blockages and scar tissue that probably saved his life. I am so scared that his coverage may be taken away. How can we do that? Sherry from Sierra Madre, California, wrote about two sons. They both have pre-existing conditions. And she says, as a single mother of two young men, just out of college, each with pre-existing conditions, I fear they're not going to be able to afford health care under the GOP plan. One son has Lyme disease and requires infusions every 3 weeks. This is a huge expense that's currently manageable under my health care plan and has been a lifesaver for him as the Lyme impacted his immune system. Under Trump Care, this treatment would probably not be financially available to him, and that would be devastating. Now, let me tell you about something that we have found out about. I look at my phone calls, and we get a lot of calls. I know something is serious when we get more than 100,000 calls, and we did on this subject. And these were largely people between the age of 50 and 64. And they weren't in the group market, they were in the individual market, which means you go out to find your own insurance company and you pay the premium. Under Obamacare, there was a subsidy for these premiums if you earned under 400% of poverty. 400% of poverty is about $47,000 a year. So if you earned under $47,000 a year, it was much easier for you to get health care. If you were at $50,000 a year, you exceed the 400% of poverty. And I am told by Covered California that the current premium in my city for someone 50 to 64 would be $800 a month. That's 20% of someone's income, 20% of an annual income. This is where the complaints are coming throughout the United States. And this is where we can make an easy fix. And we have submitted legislation, a number of us, to do just that. And what it would do is take the subsidy, and instead of going off the cliff at $47,000 a year, so that at $50,000 your premium costs 20% of your income, we changed it so that that insurance, an individual would not pay more than 9.69% of their income toward the premium. And this is just one example of how we could improve current law and, I believe, take away one of the biggest criticisms and fix it rather easily. Now, here's another problem. I'd like to share a story from Monica from Oceanside, California. These are real cases. She was diagnosed with breast cancer shortly after gaining coverage through California's individual market. Her doctor told her she would have been dead had she not been covered by her new plan. She had cared for her father 10 years prior to his death from Parkinson's disease. She didn't have access to employer-provided insurance and wasn't eligible for Medicaid at the time. By the time the Affordable Care Act was implemented, she qualified for a plan through Covered California. And she wrote, "Without the ACA, I would not be alive to write this post." I wonder if that means anything to anybody on the Republican side of the aisle. No one comes forward. No one says what they would need. And this is such a big issue. It affects every single one of us and every single one of our constituents. Let me correct something. They say also, well, Obamacare is dead. It's imploding. They say this to build support for repealing the law, but they're wrong. In California, which has worked hard to implement the law effectively, the marketplace to buy health coverage functions at a high level. There are 1.5 million people signed up through the website Covered California. Enrollments have been stable, and there has been no uptick in healthy people leaving the insurance market. The general consensus among experts is that the federal health care market is not collapsing. Standard & Poor's said that 2016 results and the market enrollment so far in 2017 show that the ACA individual market is not in a death spiral. So please, stop saying that. Mr. President, Madam President, in closing, I'd like to just say to my Republican colleagues, don't do this. Don't write a bill in secret. Don't take health care away from millions of people to cut taxes for the rich. Don't undermine protections for people with pre-existing conditions. Don't allow insurers to go back to the days of selling junk plans. And don't end Medicaid. We've known it for so long. It's working. It's covering poor and elderly all across this country. Those of us on this side of the aisle want to make the Affordable Care Act better. We want to work to improve our system. We stand ready to work together on behalf of our constituents. But if our colleagues continue down this path, we will fight this bill with all we have. The stakes are too high not to. Thank you, Madam President. I yield the floor.